maximize my screen. Very good. Good morning, good afternoon, good evening, colleagues. My name is Brian Morales from the U.S. Department of State, and I'd like to welcome you to the second meeting of the Global Coalition to Address Synthetic Drug Threats, Subworking Group 2.1. Beginning this month of November through February, we will be looking at specific initiatives available to us through international organization partners. We will also be exploring new activities or policies that we can initiate. In January and February, we will have the full menu of activities available for review, and we will invite you to express your interest to the international organizations that are managing the respective initiatives. Some other administrative announcements. Please update your screen name so that it lists your name, your organization, and your country. And thank you also for your feedback regarding the number of calendar invites. We recognize that we have been sending many calendar invites to participants on an hour-by-hour basis. So for future meetings, we are going to send one single calendar invite for the entire 4-hour block of meetings for subworking groups 1.1 through 2.2. And for the 3-hour block of meetings for 3.1 to 3.3. We will still send invites for the East and West groups, so you can choose whatever time you prefer. I notice there are some colleagues from the Americas here today. They are most welcome. I will just highlight that interpretation for this session, as Cyril mentioned, is in Russian. And in the West group, we have interpretation in Arabic, French, Spanish, and Portuguese. I also want to share that the coalition website has launched. You can find the new coalition website at globalcoalition.us, and I'm going to ask Sarah to please post that in the chat. Now, following these administrative announcements, I want to mention we have our co-chair for Subworking Group 2.1 is Dr. Heti Widyastuti, Coordinator of Special Healthcare and Rehabilitation, Directorate General of Corrections of Indonesia. I'm going to turn it over for Dr. Hedi to introduce and provide some welcoming remarks. And then following that, we will have a presentation on developing early warning systems at a national level and the UNODC Global Early Warning System. And Dr. Martin Raithelhuber will be presenting that from UNODC. And then we'll have a country testimonial from Dr. Agus Irianto, the Police Inspector General from the Republic of Indonesia, from BNN. And then after that, we will have regional and sub-regional early warning systems presentation from Joanna de Morais from the European Monitoring Center for Drugs and Drug Addiction. So with that, I will turn it over to Dr. Heti for the introduction and moderating the session. Thank you so much.
Thank you so much, Brian. Okay, good morning, everyone. This is such a interesting meeting that we will have this morning about an early warning system. An early warning system is a warning system that can be implemented as a chain of information communication system and compresses sensors, event detection and decision system for early identification of hazards and to minimize its impact. It's aimed to mitigate the risks produced by something that we can call disaster by providing advance notice of potential hazards, enable individuals, communities, and organizations to take appropriate measures to minimize the potential effect. In this morning, we also have the presentation for the multidisciplinary interagency network. As Brian already mentioned, we have Martin Raithelhuber from Illicit Synthetic Drugs Expert UNODC, Dr. Agus Irianto from National Narcotics Board of the Republic of Indonesia, and also Joanna de Morais, Scientific Analyst, European Monitoring Center for Drugs and Drug Addiction. So this is such an interesting opportunity for us to talk to each other and hear from the experts to share their interesting experience also. And we hope for this morning, we can end up with something that we can establish from the presentations. And perhaps it's the opening remarks, Brian. We can continue to the presentation.
To be here with you. Yes, I'm going to speak about developing early warning systems at a national level. Why do we absolutely need that? And then switch over to the UNODC global early warning system, what that can bring for our national partners present here in this meeting. But before I'm starting, I want to recognize our collaboration. We're not the only ones doing early warning and supporting national early warning systems. I see a lot of colleagues and partners here in the audience from the Organization of American States, SICAD, and also from the EMCDDA. But let me start my presentation here as a teaser, maybe, to start with the topic on early warning. Are you able to see my presentation?
Yes, we can see your presentation. Go ahead, please.
All right. So why do we need early warning? I mean, we see a massive expansion of the drug markets worldwide, whether we are talking about cocaine, methamphetamine, heroin, or other drugs like ketamine even. We see also emerging of previously separate illicit synthetic drug markets in Americas, Asia, Europe, linked by international organized criminal groups. And we see in particular large-scale clandestine laboratories producing particularly synthetic drugs, but also the precursors chemicals needed for their manufacture. So there's a lot happening, a lot of dynamics happening here. And I haven't even mentioned the new psychoactive substances. I'm sure we are all aware of. Over 1,250 of them have emerged in the last 10 years and are complicating the whole scenario. So this is where what we are facing in our work in different ways. So realities are changing. There are new psychoactive substances, synthetic drugs, there are traditional drugs. All these names are making no longer such a lot of sense, maybe in some cases, because the whole problematic comes together at the local level. And that's what we want to talk about today, national early warning, things happening at the local level, the changes you want to be aware of, and then inform your stakeholders about. Just some examples of what is happening out there in your countries. Maybe, for example, fentanyl and other synthetic opioids have emerged in many Western Hemisphere countries, replacing heroin to some extent. Even more complicated, xylazine, a toxic adulterant, is found in samples of heroin and fentanyl, complicating the health, negative health implications for users. In some instances, cocaine and methamphetamine has been laced with a highly toxic opioid like fentanyl, often unknown to users, etc., etc. So this is the situation you're facing. Let's say the whole complexity of this changing global market, changes particularly in the synthetic drugs, they're playing out at the national level. And these are the effects you're seeing at the national level. And you want to capture with an early warning system because you want to capture them as soon as they happen, be aware of them, and then give advice on policy responses to your stakeholders. So what are the elements of a national early warning system? I try to break that down to a very, very simplified and generic level, because I hope we're going to hear much, much more from our national colleagues here in the room. The main elements I selected here, the three main ones, is to have a data flow, of course, representing the relevant indicators. For example, if there are new substances on the market, if the purity levels change, going up, going down, if there are toxic adulterants in drug samples, like psilocin was my example, if the forms of presentations are changing, imagine THC cannabis products are suddenly presented in the form of chocolate, in the form of gummy bears, etc., and that might be new to the market. You want to be aware of it and make others aware of it. But that could also include emergency room presentations, data on overdose events, etc. In a nutshell, when we talk about data for early warning, we're very often talking about forensic and toxicology data, because that data is produced regularly and can be made available to the early warning system at the national level. Now, once you have this data needs to be assessed, analyzed, what it actually means. Usually that is done by a multi-agency technical table or a kind of committee looking at all the information coming into the system and deciding what to do with it. Does it need action? If so, what would the action be? So we're coming to the third element here is communication. Early warning means exactly that, communicating. That could be an alert, but I put it into inverted commas because not every information the system produces is an alert necessarily. It could be also an early warning message, making stakeholders aware of the recent development. And these stakeholders can be very diverse. This could be the health sector in the country. This could be services catering for drug users. It could be the law enforcement, other laboratories, even the judiciary. It could be drug policymakers. The idea is always that these alerts make people aware who can take action and minimize the risks associated with this new development. So in a nutshell, that's early warning at the national level. Simplified it, I admit, very, very much. For the sake of time, I would like to move over to my next topic, and that is what can the international early warning, like the global early warning system at UNODC, bring to you? What can we offer? And again, I'm trying to share my screen.
And we can see your screen.
Perfect. Good. This is the front page of the UNODC Early Warning Advisory. It offers a lot of information. A good starting point is usually the news side, what has happened most recently. But maybe I'll run you through an example. Let's say you are a country in the Western Hemisphere. Any country in the Western Hemisphere, you want to know generally what is happening with new psychoactive substances emerging in your region. You want to be alert, aware of what is happening. With our system, you can select your region. Here I selected South America. You can drill down to a specific effect group. I selected here hallucinogens and dissociatives because you notice here that in the region, this group plays a bigger role than in other regions in terms of the number of new psychoactive substances belonging to that group. And you will also be aware from your epidemiological surveys that drugs like LSD, drugs like ketamine have a certain prominence in your drug market. Now you want to drill down further of which are the latest developments here. You may have been aware of some ketamine products, and you may want to know, are there also some new psychoactive substances related to ketamine? And indeed, again, selecting South America and selecting just 2022 and 2023, you notice that, yes, there is a ketamine derivative, which has emerged already in Brazil and in Chile, the 2-fluoro-deschloroketamine. Now, it's just two countries which have reported this substance so far. So you may wonder, like, how relevant is this information? Is it just these two countries? Have other countries seen this substance as well? And you're drilling down further in our system, looking at all the countries which have reported this substance, 2-fluoro-deschloroketamine, in the last 2 years. And you see a whole list of countries which have indeed reported that substance, from Australia over European countries down to the United States. So indeed, this substance has not only emerged in Chile and Brazil, it has emerged in practically all the continents. That is an important information here. So it's not a one-off thing. You can then look also if this substance maybe has been placed under international control already recently. There have been so many developments, between 7 to 10 new psychoactive substances are placed under international control every year. Maybe it was one of them. So our system allows you to see that information here on the scheduled NPS. And again, I selected the hallucinogens and dissociatives just to restrict the information to that particular group of interest. And you see there has been a number of substances, some N-bomb compounds, indeed a ketamine derivative methoxetamine, but not the one substance we are looking at the moment, the 2-fluorodeesketamine. It has not been one of them. But looking at our news, you will find out that indeed the WHO, World Health Organization Expert Committee, has looked at this substance already. Here it is, 2-fluorodeeschloroketamine. So they're currently reviewing this substance for international control. So because I also thought it needs a closer look. If you click on this link here, the link of the substance, further information will open in the system on chemical details, scientific information related to the substance, information on how to analyze the substance into your laboratory so that you can include it into your routine work. Here are some examples. And you will also find information on what the expert committee on drug dependence from the World Health Organization has found so far about the substance. And there's a whole report there at the WHO, which, among others, explains how the substance has emerged on the market, which countries have already regulated it. And interestingly, it has also been found in China, here in chocolate samples, for example. So that may be something you have not been aware of. So now that was a very, very brief and very rapid run through information available at the UNODC early warning system, which is available at your fingertips and which you can benefit from for your own decision making, particularly if a substance and information, a development is relevant for your work or not. Now, let me try to stop sharing. Here we go. And this is the end of my presentation. Looking forward to your comments, questions. Thank you.
Thank you, Martin. Brian, should we straight to the discussion or another presentation?
Since we're recording, I would recommend we do all the presentations first, and then we can have the discussion afterwards. Thank you.
Okay. Thank you. Okay. Thank you very much for the excellent presentation, Martin. So the next presentation is country testimonial from Dr. Agus Irianto, Police Inspector General for Legal Affairs and Cooperation, National Narcotics Board of the Republic of Indonesia.
Good morning. Following the workshop by UNODC on December 8 until 9, 2022, Indonesia recognized the importance of disseminating information regarding the development of NPS, including their variety, effects, and modus operandi. Therefore, the stakeholder, including Narcotic Laboratory of the National Narcotic Board, Ministry of Health, Laboratory of Indonesian National Police, Laboratory of Custom and Excise, Food and Drug Administration, and academics, have agreed on establishing the NPS early warning system, with the National Narcotic Board was pointed as a leading sectors. This initiative demonstrates the commitment to avoiding evolving threats and fostering a safer environment. As of November 2023, there are 170 NPS circulating in Indonesia, with 163 of them already regulated by the Ministry of Health. However, we can report that Indonesian laboratories have identified 93 types of NPS, with 3 NPS, ketamine, mitragina speciosa obratum, and alpha-propylamine peniopenon are not yet regulated by Ministry of Health. In addition to synthetic cannabinoids, multi-compound cases also dominate the samples at the Center of National Laboratory. Recently, the NPS identified at the Narcotics Laboratory of BNN in 2023 are fluorohexamines on May 2023 and MDMB Inaka on August 2023. The development of NPS data in Indonesia is able to be accessed at ews.bnn.go.id. The website classifies NPS into 7 categories: plant-based substances, piperacins, penethylamines, penicillin-type substances, tryptamines, synthetic catechinones, and synthetic cannabinoids. Moreover, the website presents NPS data in statistics, and the publication contains research articles. Last week, the Narcotics Laboratory of the National Narcotic Board held a consultation meeting for the EWS. This meeting agreed to hold a joint working group per semester among the BNN Laboratory, Police Laboratory, and Custom Laboratory to complement data and exchange information regarding the latest development in NPS and new modus operandi. In conclusion, Indonesia expressed its utmost appreciation to UNODC for the establishment of the early warning system, which is still in the development process. We acknowledge that building such a platform requires time and careful consideration to ensure its effectiveness for stakeholders and the community. We believe the development of the EWS platform is a form of resistance against narcotics, requiring national and international commitment and collaboration. I thank you.
Yes, it's the recording for the National Narcotics Board of the Republic of Indonesia. So we go forward for the others presentation for regional and sub-regional early warning system. Joanna de Morais, EMCDDA.
Many thanks, Benoit, for the kind introduction and for the opportunity to present today. Good morning, good afternoon, everyone, wherever you are. I will be presenting on behalf of the Early Warning System team. Let me share my slides. Let me know if you can see them in the...
We can see the slides. Go ahead, please.
Thank you so much. So last year, the EU Early Warning System on new psychoactive substances celebrated its 25th anniversary. It was the first regional early warning system to be established to monitor NPS, and soon it has been recognized as a model for national, regional, and international early warning systems. The EU early warning system was established in 1997 after concerns that the emergence of ecstasy had revealed a lack of capacity in Europe to identify and respond to the appearance of uncontrolled substances that could be used for their psychoactive properties and cause harm. This led to the introduction of the first piece of EU legislation known as the Joint Action on New Synthetic Drugs that you can see in this slide. And of course, a lot has happened since then. The market has undergone periods of significant growth and change. And in response to these developments, EU legislation has been strengthened twice over the last 25 years, with the intention of providing a stronger and faster response to NPS. EU early warning system is currently operating under the legislation from November 2017. And EU legislation defines a three-step framework of early warning, risk assessment, and control measures, which allows the European Union to rapidly detect, assess, and respond to the public health and social threats caused by NPS. The EMCDDA is responsible for the first steps in this system, which are operating the EU early warning system and conducting risk assessment. The European Commission is responsible for the last step for proposing control measures. The EU early warning system is composed of a multi-agency and multidisciplinary network, which includes, of course, the EMCDDA, 29 national early warning systems, Europol, the European Medicines Agency, the European Commission. The early warning system cooperates with a number of partners, including, among others, WHO, UNODC, EMCB, as well as forensic and toxicology networks such as TF and the APCCT. At the core of the early warning system are national early warning systems, which differ across Europe, as of course situation is different in every country. The organization and functioning of the national early warning systems are a national responsibility. However, experience shows that in order to function effectively, national early warning systems require a multi-sectoral, multi-agency, and multidisciplinary approach, and regular collaboration with national partners, including, among others, forensic science and toxicology laboratories, law enforcement agencies, poison centers, healthcare providers, drug checking services.
And my apologies, I'm sorry for interrupting you. Interpreters are asking you to slow down, please. Thank you so much.
Sorry, I wanted to gain a bit of time. I know that we are behind schedule, sorry. The development of standards and best practices, such as operating guidelines and standardized data collection tools, are really important for the functioning of the early warning system. And after the new legislation came into force, updated early warning system guidelines were developed, and you can access them through the QR code in this slide. These guidelines serve to provide a common understanding for the operation of the early warning system by detailing the rationale, steps, procedures, roles, and responsibilities. The EMCDDA has developed a common terminology and definitions, as well as a set of common reporting tools in order to harmonize data collection across the network. In addition to the updated guidelines, a redesigned database on new drugs, EDND, was launched in 2019, providing the EU with a next generation information system capable of electronic data management. In this slide, I would like to briefly present an information flow in the early warning system. When an NPS is identified for the first time in a member state, a formal notification is issued to the network by the EMCDDA on behalf of the member state that reported their substance, and it is known as the first identification in Europe. The NPS is then monitored by the EMCDDA for signals that suggest it might pose health or social risks. For this, the EMCDDA uses information reported by the member states through the early warning system and other relevant sources, such as open source information. Following analysis of a signal by the EMCDDA, response actions might include intensive monitoring of the NPS, risk communications, and the production of an initial report, which might lead to a risk assessment. Similarly to early warning system guidelines, updated risk assessment guidelines have also been developed by the EMCDDA to operationalize the technical aspects of the risk assessment. The guidelines are supported by a set of guidance notes. And again, these are available on our website through the QR code. So far, 37 NPS have been risk assessed by the EMCDDA. And it is important to note that this work is not only relevant for Europe. EU early warning system supports and contributes to the work of the WHO and the UNODC by feeding information into the UN system. And now, very briefly, regarding the current situation with NPS in Europe. Currently, the NPS market is characterized by complexity and increased integration with the market for established controlled drugs. As of today, through the EU early warning system, we are monitoring around 950 NPS. And so far this year, 22 new NPS have been detected on the EU market, which constitutes a preliminary drop compared to previous years. However, at the same time, last year, a record quantity of 30 tons of NPS was seized. And this was driven by a small number of large-scale seizures of caffeinols. Over the last year, we have also seen an increase in harms linked to nitazoxanide opioids, emergence of trunk and benzodope in Europe, and outbreaks linked to the opioid market. To conclude, in this slide, you can see some of the lessons learned over the past 25 years. Reliable and timely information is critical for an effective public health response. And local, national, regional, and international early warning systems have all played a valuable role in providing information for action. Early warning systems need to continuously adapt to the ever-changing drug markets to ensure that they are fit for purpose. Co-production as well as engagement between partners at local, national, and international level has also proved critically important. And finally, day-to-day work of the early warning system is only possible due to continued commitment and support from the EU early warning system network. I would like to take this opportunity to thank our correspondents, colleagues from national networks and experts. I know that some of you are here today in this meeting, so thank you so much. And for everyone, in case you would like to learn more about the EU early warning system, I encourage you to visit our website. Thank you very much for attention.